On January 28, 2025, a major outage hit the federal health payment system. This system, known as the Payment Management Services Portal, is crucial for the flow of funds to various healthcare providers. The White House attributed the disruption to a technical glitch. However, many suspected a link to the Trump administration's recent freeze on federal spending. This freeze, enacted just days prior, had already begun to cause anxiety among healthcare providers who rely on government funding. Adding to the confusion, a federal judge issued a temporary stay on the freeze. This legal challenge further clouded the situation and raised questions about the legality and long-term viability of the administration's actions. The coincidence of the outage and the spending freeze immediately sparked concerns among healthcare providers and advocacy groups. The timing raised suspicions that the outage was not merely a technical glitch, but a consequence of the administration's efforts to curtail spending. The lack of clear communication from the White House only fueled these concerns, leaving many to speculate about the true cause of the outage and its potential impact on healthcare services. The freeze itself was already facing significant pushback. Opponents argued that it was implemented without proper consideration of the potential consequences. The legal challenge further underscored the controversial nature of the freeze, putting the administration on the defensive and raising questions about its commitment to transparency and due process. The situation was further complicated by the fact that the administration had already announced a review of all HHS programs. This review, aimed at ensuring compliance with an executive order restricting funding for elective abortions, added another layer of uncertainty to an already volatile situation. Healthcare providers were left wondering how this review might further impact their funding and operations. The impact of the outage and the spending freeze was felt most acutely by those who rely on federal health programs. State Medicaid agencies, responsible for providing health coverage to millions of low-income Americans, were particularly vulnerable. Many reported being unable to access the PMS portal, hindering their ability to process payments to healthcare providers. Community health centers, which serve as a vital safety net for underserved communities, also faced disruptions. These centers rely heavily on federal grants and were left scrambling to cover operational costs and ensure continued access to care for their patients. The Head Start program, a federal initiative that provides early childhood education and other services to low-income children and their families, was also caught in the crosshairs. The program relies on federal funding to operate, and the freeze threatened to disrupt services for some of the nation's most vulnerable children. The uncertainty surrounding the freeze created anxiety and fear among Head Start providers, who were left wondering if they would be able to keep their doors open. The freeze also had far-reaching implications beyond the realm of healthcare. The National School Lunch Program, which provides nutritious meals to millions of children from low-income families, faced potential disruptions. The program relies heavily on federal funding, and the freeze threatened to jeopardize its ability to provide meals to those in need. The uncertainty surrounding the program's future caused widespread concern among parents, educators, and child nutrition advocates. Adding to the chaos was a lack of clear and consistent communication from the Trump administration. The Department of Health and Human Services, the agency responsible for overseeing many of the affected programs, offered limited information about the outage and its potential impact. This lack of transparency fueled confusion and frustration among healthcare providers who were left in the dark about the status of payments and the future of vital health programs. The administration's silence was particularly concerning given its history of implementing controversial policies with little warning or explanation. The sudden nature of the spending freeze and the lack of clear guidance left healthcare providers scrambling to adapt and raised questions about the administration's commitment to transparency and accountability. This communication blackout extended beyond the HHS. The White House, typically quick to respond to major news events, maintained an unusual silence on the matter. This lack of communication from the highest levels of government only served to exacerbate the sense of uncertainty and fear among those affected by the outage and the spending freeze. The administration's decision to withhold information fueled speculation and conspiracy theories, further eroding public trust. The lack of a clear and coordinated communication strategy only amplified the negative impact of the outage and the freeze, leaving many to question the administration's competence and motives. While the immediate focus was on the technical outage and its impact on payments, the situation also raised broader concerns about the Trump administration's approach to healthcare policy. The spending freeze, seen by many as a tactic to advance a conservative agenda, signaled a potential shift away from federal support for healthcare programs. This raised alarms among healthcare advocates, who feared that the freeze was just the first step in a larger effort to dismantle the Affordable Care Act and other key health programs. The administration's simultaneous review of HHS programs, particularly its focus on restricting funding for elective abortions, added another layer of complexity to the situation. This review, coupled with the spending freeze, suggested a broader effort to reshape the healthcare landscape according to the administration's ideological priorities. The uncertainty surrounding the future of federal funding had a chilling effect on healthcare providers. Many were forced to delay hiring decisions, postpone investments in infrastructure, and even consider scaling back services. This climate of fear and uncertainty threatened to undermine the progress made in expanding access to affordable healthcare, and could have long-lasting consequences for the health and well-being of millions of Americans. The events of January 28, 2025, served as a stark reminder of the fragility of the nation's healthcare system and the profound impact that political decisions can have on the lives of ordinary Americans. The outage, the spending freeze, and the communication blackout all pointed to a deeper dysfunction within the administration and raised serious questions about its ability to effectively govern and protect the health and well-being of its citizens.